from Thoughton Physical Therapy. Here again for another session of Facebook Live. Hope everyone had a good weekend last weekend, as it was Memorial Day, so we weren't here. The clinic was closed. For those of you who have not turned in, my name is Todd from Thoughton Physical Therapy here in Attleboro, Massachusetts, and I decided to reach out to add more value to more people and to be able to touch more people's lives through the field of physical therapy. I am pretty much a full-time treating physical therapist, and I really love what I do, and I'm passionate about what I do, and I want to ease suffering for people in any way that I can. So that's why I started doing the Facebook Live through different topics. And so I'm really excited to be back again this week. This is my favorite part of the week. So this week's topic is obstacle course race injuries, upper body, how to diagnose, treat them, and to be able to just compete effectively without injuries. And for those of you who have already watched one of the episodes, welcome back. I love getting emails. I love getting live posts. If you have any questions, please feel free to reach out to me at todd@thoughtonphysicaltherapy.com. So the reason why I decided to talk about obstacle course race injuries is that it's that time of year. Everyone's getting excited about doing these races, and I wanted to be able to add more value for people who maybe have had a question about the diagnosis, if the physical therapy can help, and what it can actually do for them. How's it going, Deb? Hey, Mike, thanks for joining again. So you are watching if you're an obstacle course racer or any type of athlete that has neck pain, whether it's a bulging disc, herniated disc, whether you have headaches, whether you have shoulder bursitis, rotator cuff tendonitis, rotator cuff tears, tennis elbow, golfer's elbow, or any type of wrist tendonitis. And what I'm going to let you know throughout this is that 100% certainty, any of the injuries that I just talked about are all going to be related to your neck and all going to be related to your upper back and the thoracic spine not moving. So that's a little tidbit of information that I'm going to explain how and why I get to that thought and idea. I love treating the cause of the injury, not the result of. So many times through the field of, medicine in general, a lot of times people treat the symptom of something else or the result of something else. So I'm going to go over why treating the cause of it and why everything's going to be starting from the cervical spine of the neck is a really important piece to look at. I can tell you when people go for like other types of techniques or something that might be flashy or new or fun, a lot of times people I can guarantee you that you're going to hit a ceiling eventually. 3 guarantees. Number 1, you're going to hit a ceiling. Number 2, it's always going to catch up to you. And number 3, the lack of dedication or preparation is going to lead to overtraining and when frustration sets in. You're going to feel like you're going to need to increase, you're going to go faster, and the need to go faster and stronger is a drug, and like anything else, that's not going to turn out in the end. We really need to build a really good baseline. We really need to build a really good foundation. Super important. So as a physical therapist, I treat the spine. I mobilize the different segments of the spine. The other thing that I want to do is I want to educate you on the proper diagnosis and the treatment plan. I believe through all the different research, especially over the last couple of years and thousands of patients, is that I need to find your starting point. A lot of people are doing really good exercise. A lot of people are doing really good stretches and all sorts of different techniques, but they're not finding the right starting point. So I need, as a physical therapist, to find out, where are you starting? I need to know what does the body look like? How is it moving? I need to do a full assessment of the whole body. Where are you in your training cycle? How is your core strength? And how dedicated are you to completing those core exercises that need to be treated every single day? We need to work them. Well, it took a 1 to 2% change, and the problem with it's really easy, and it's a simple thing to be able to do, but a lot of people don't want to be dedicated to that. I want to teach you activation techniques with impeccable form. I had a patient that just came in again today, so I just want to tell you a little bit about this patient that came in today. The patient, the first time he came in, he had some elbow symptoms. He does some CrossFit, and he does some obstacle course racing. So the first day he came in, he had tightness in his elbow. He had medial epicondylitis and lateral epicondylitis. And what happened was when he came in, I talked about his cervical spine, and I explained to him why the cervical spine could be leading to symptoms in his elbow. So the first time he came in, I showed him that, and I was actually able to take away his elbow symptoms by just working on his upper back and by working on his neck. What I noticed the second time he came in, I asked him, how did you do with your exercises? And he said, well, I didn't really do them. And I asked him, well, why didn't you do them? He didn't really have a buy-in. So then I didn't really do a good enough job to let him know how and why he needed to do it. And I didn't really get, I mustn't have really had a good explanation for you. So then the second visit, I explained a little bit more about the anatomy and how the symptoms could change in his elbow. The second visit, he went home and he did a lot of his exercises, and he came in again today. Today was his third visit. And I asked him how he was feeling, and he said that he felt he felt a little bit of elbow tightness, but it wasn't really bad. He noticed a big improvement by working his upper back and by working his neck. I just gave him 3 simple exercises to do. Today when he came in, I worked on his cervical spine, and I took away his elbow tightness away completely. Now, he had already gone to different things like different type of modalities for treatment, all things that we do here, dry needling, Graston, some other different techniques, some soft tissue techniques, seeing a massage therapist, and his symptoms weren't better. But when we went to treat his neck, and he's feeling a lot better today. So that's just an example. So just a little bit of anatomy to get you really excited. I get super excited about anatomy. There's 3 things that we really want to address with the cervical spine, because I believe everything 100% is related to the neck and the activation of the neck and the upper back. Any of the injuries that I'm going to talk about tonight. So the first one is the deep neck flexors. Most important. We need to work the deep neck flexors to turn on the fuse box, which is going to give us power all the way down the arm. The next, and that's by doing a chin tuck head lift. Super important exercise. The next one is to work the scapular depressors. So when we squeeze our shoulder blades together, it's really going to work on our posture. Very important. And it also turns on the fuse box. And the third one is going to be the lat muscles. The lat muscles, which we use, for pull-ups and a lot of hanging, which you do a lot in obstacle course races. So those are the 3 most important muscles that I'm going to say in the upper body that are going to be crucial, that we need to address those, and that's going to make night and day change with you. The next thing I'm going to talk about is the upper trapezius, the most overworked muscle, the upper traps. Nobody should be working their upper traps. Nobody should be doing shoulder shrugs. I don't feel, because it changes the mechanics of your shoulder. And the only thing, the idea of your upper traps is to hold your head up. So when I see people doing shrugs in the gym, it kind of makes me chuckle. Then we have just some other anterior neck muscles. We have the pec muscles. We have the rotator cuff muscles. We have the biceps and triceps. All those muscles are going to be secondary muscles. Once, if your neck is addressed properly, then all those muscles in the upper body are going to be working a lot better. So when someone comes to see me for physical therapy, like the gentleman I just talked about, my patient today, is that I'm going to see a few different things. When they come in, the first thing, when I go over why the neck is important and what that difference that's going to make, they're really going to go, I get it, it makes a lot of sense, I'm going to follow this form. The second thing they're going to come up with is they're going to go, well, it kind of sounds okay, makes a little bit of sense. They're going to try it for a little bit, maybe a week or 2, and they're not going to notice the immediate results that they want to get. The results are not quick enough, and then they decide to not follow the plan. I'm going to see them 3 to 6 to 9 months later with the same injury, or either they've gone somewhere else for treatment and they're still getting the same thing a year later. The next person that I'm going to see, the third type of person I'm going to see, is they come in to see me and they're going to go, yeah, it doesn't really make sense, and they're not going to follow the treatment plan at all. How's it going, Neil? Thanks for tuning in. Jay, thanks for tuning in. And Megan, thanks for tuning in. So I'm going to go over some of the common injuries using my 24 years of experience, and especially data testing over the last couple of years, the idea of the fuse box and how important that is for your upper body. So the first thing I'm going to talk about is I'm going to talk about neck pain. So some different things that an obstacle course racer, because you're always hanging, you have to do a lot of pushing, you have to throw the spears and some of the Spartan races, but it's a lot of upper body stuff. You have to climb up over walls. A lot of times people will get neck pain. They're going to get a bulging disc, they're going to get a herniated disc, and they're going to get headaches likely as well too. So what is the cause? I'm going to go over the cause and different treatment techniques for each one of these injuries. The first cause of neck pain is violating normal principle of motion, and that just means that we're working more on grip strength as opposed to working more on core strength. We need to address the core strength all the time, and the grip strength is a secondary thing that needs to come. So violating principle of how the body normally moves. The next thing is muscle imbalance. We don't have enough deep neck flexor strengthening exercises. We don't have enough scapula depressor strengthening exercises. In your mid-back, your thoracic spine just doesn't move enough. We need the mid-back to move enough. We need the neck to be stable and the low back to be stable. So those are the different causes of neck pain. The treatment for that is I need, as a physical therapist, to treat the cause and not the result of the cause. Goes back to a couple of simple principles. I'm going to treat this. I'm going to find your starting point. Where is your core strength? Where is your stability? I'm going to mobilize and I'm going to work the upper back to make sure it works. I'm going to activate the deep core muscles in the neck. I'm going to activate the abdominal muscles. I'm going to activate the core and the glutes. How am I going to do this? I'm going to do the chin tuck. I'm going to do the chin tuck head lift. I'm going to do different forms of shoulder blade exercises and different exercises to work the lats. But the biggest thing I'm going to go address is the posture. How's it going, Gene? Thanks for tuning in. Posture, 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 posture. We need to have the body in good alignment all the time to be able to address the right core muscles, to be able to produce the strength all the way down to any of the arms, to the fingers, the elbows, or the shoulders. The next injury I'm going to talk about is shoulder bursitis and tendonitis. Super, super common. We hear it all the time, bursitis, tendonitis, rotator cuff injuries, all these different things. I'm going to lump them into the same category. Again, what is the result of? Guess. That's right. You got it. The neck. Always going to be the neck. It seems really simple, but hopefully you're seeing a pattern here. I'm also going to be, if you have a shoulder issue, I'm going to look at the fifth vertebrae in your neck, because that's going to give you referred pain down over to the shoulder. Also, the cause of it is also going to be violating the principle of motion by doing too many smaller muscle group things and not making sure that we hit the core while doing the exercise is not having impeccable form. I'm going to look for muscle imbalances. I know that your neck's not going to be as strong. I know that your shoulder blade's not going to be as strong. I know that your mid-back's not going to be mobile enough. Again, same pattern I'm seeing. Also, what I'm going to see, because you do so many burpees and obstacle course races, too many push-ups, too many burpees, but not working the opposing muscle groups. Crucial, we need to work the opposing muscle groups. So as a physical therapist, what am I going to do for treatment? I'm going to find out what is your starting point. Where is your core at? Where are the strength deficits? And I'm going to start right there. I'm going to make sure your upper back moves well. I'm going to activate the fuse box. I'm going to turn on the neck. I'm going to turn on the shoulder blade muscles. I'm going to work the abs in the back. I don't remember the last time that someone came in that I actually worked on, treated or rubbed and massaged the shoulder, because I believe if I can mobilize and work the spine, work the core muscles, this should just resolve on its own. Again, posture, 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 super important. So my favorite one is I have tennis elbow and I have golfer's elbow. Tennis elbow is when people kind of gets the term from doing a backhand type motion when you're swinging a tennis racket. It's when the outside of your elbow hurts. Golfer's elbow is on the inside, the bone on the elbow, when you're coming in, when you're doing like the downward swing with a golf club. So for someone that comes in with that, the patient that I had come in today, I went to his sixth cervical vertebrae. I went to his fifth, sixth, and his seventh cervical vertebrae. I mobilized them, and that's actually what took away his elbow pain, where he had no tightness when he left today. And I gave him, again, 3 simple exercises, and he's already well on his way for recovery. And I can tell you, I am not going to be touching his elbow at all for any of his treatment, because that's not the problem. So I'm going to look at the 6th vertebrae in the neck. For tennis elbow, golfer's elbow, I'm going to look at, the cause is also violating the principle of motion. Too many exercises, if you're doing bicep curls or triceps when you're lifting weights, in which the posture is your head is forward when your shoulders are rounded. Again, impeccable posture when you're doing all the lifts, and make sure you're doing the lifts a little bit slower. I'm surely going to see that the abs and the core aren't going to be strong enough. So again, that's another cause of what's going to happen, believe it or not. I had someone that came in and I just worked on making the low back and their glutes strong, and it actually helped out their shoulder, and I see that almost every day. So what is the treatment for tennis elbow? Surprise, surprise, I'm going to find their starting point. What is their starting point? I'm going to go right up to their neck, and I'm going to address the core. So again, it's the same thing. I'm going to work on their neck stability. I'm going to work on their postural muscles. I'm going to work on their mid-back. Everything's going to start moving better. I'm going to work on the chin tucks. I'm going to work on the core muscles. And as the last resort, which again, I'm not going to even get there, is working on the elbow. Why? Why am I not going to work on the elbow? Because it's not the problem. Never the problem. It's always a result of a neck issue, period. Sprained wrist tendonitis from a lot of gripping. Again, obstacle course races, a lot of monkey bars, a lot of pulling on ropes, throwing the javelin. If you don't have a strong enough core when you're throwing it or when you're going to grip something, then you're going to get the wrist tendonitis. Why? Because we're not generating the activity in your neck to give you power into your hands. So I'm not going to go through all that again. It's going to be the same principle that we did for the first couple injuries. A wrist issue is always a result of some postural imbalance or some training with not good posture. So for me as a physical therapist, there are a few musts. I have to evaluate and I have to find what is the cause of your symptoms. I'm not going to treat the result of them. I'm going to treat the cause. And I'm going to do everything I can to work on the neck and the upper back to see if I can resolve all these symptoms down over here. And I'm going to do that most of the time. And then my other question would be are you overtraining? What is your regimen? I'm going to have a lot of questions about your training program. I would rather go into a contest 10% undertrained than 1% overtrained, 10 to 20% undertrained than 1% overtrained, because the body's not going to function well. Like I said, to start off with 100% certainty. Anything with the upper body, doesn't matter what it is predictable, and it's caused by the neck 100% of the time. And I need to come up with a calculated strength training program, core training program. Lots of good exercises out there, but we need to do it in the right sequence, in the right order. And that's why finding a starting point is the most important piece. So now, one of my favorite things is to go over some of the questions that people have written in. When I'm doing monkey bars, my shoulder feels like it is giving out. I am doing monkey bars a lot, but I am not making the gains that I think that I should. What do you suggest? That's a really great question. A lot of people, I'm sure, have this, and you're wondering why. People, their shoulders just feel like that they're going to give out. Whenever someone's doing the monkey bars, or if their shoulder's going to give out, I can tell you it's a core issue. We're not activating the neck. Your neck is probably coming forward, which you're out of position, and it's shutting off all the power to your arms. Believe it or not, if you don't have strong abdominals or low back muscles, when you're doing any of the monkey bars, any of those hanging exercises, your shoulder's just going to give out. So we need to give a good assessment. Where are you? Where are your imbalances? What does your core look like? What does your low back look like? I see it every single day. Another thing I wanted to bring up is that I see this with athletes all the time, is that athletes get to bypass many of the initial and the foundation exercises, not because they want to or it's intentional, it's because they can. They bypass some things, and then when they get on, they're going to reach a ceiling, and when they reach the ceiling, they're going to get frustrated, they overtrain, and then they're going to get hurt. So really it's important to find out that starting point, and for you specifically, for your abs and your back, and then the neck muscles and your upper back muscles. That's going to make a huge difference for you on your on doing the monkey bars. Then you're going to start seeing your gains go right up. When I'm doing burpees, I have front and side shoulder pain. I am doing the typical rotator cuff with the band exercises that I looked up online, and I'm still having the pain. For anyone that's seen this, let's give them some help. What is the problem? It's the neck. It's always the neck. When you give, again, rotator cuff strengthening exercises are great, but if your head isn't over your neck, which isn't over your shoulders, and the body is not in good position, it doesn't matter what we're going to do. We're going to keep increasing the inflammation, keep increasing the pain, and the motion's going to go down, and your function's going to go down even lower. So for that, I would want to make sure you're doing a chin tuck to have good posture, squeezing the shoulder blades together, and then you want to complete the shoulder exercises with that. I'd rather start off a lot easier with some low repetitions, I should say some high repetitions with some low resistance, and then take it from there. Great question though. Next question is, when I am 2 to 3 hours into a race, I notice that I start tripping and losing my footing. What could cause this? So I'm going to go back to, it's the fuse box, it's a core issue. Whenever we have a position in which we get tired, what do? We kind of slump. And I know through all my research is that whenever I get into a slump position, whether you're looking at your phone, whether you're walking with your head down, when you get into a slump position, it turns off the strength to a lot of muscles in your body. So the reason why you're doing that is, I bet, just because of a posture, as you get tired, as you get running or walking for a longer period of time, people tend to slump, which is going to shut everything off. So I would say you want to really look and address your posture and make sure you're doing enough exercises to have strength in your upper back, your lower back, and your glutes to allow you to have that upright position as you're getting more into the race. Again, strength training, huge. Everybody needs to strength train. It's a great question. Thank you. What do you feel is the most important advice you can give someone who is just starting to train for an OCR obstacle course race, or a seasoned veteran as far as training and making gains? That's an awesome question. If I was going to say one thing for that, it would be to find your starting point. When people come in for physical therapy, that's what I see all the time. They got to find their starting point. Once we can find your starting point, that's when we can come up and develop the best program for you. Planks are great exercises, but not if you can't hold the abdominal set. A full plank, doing a lot of different poses, a lot of other strength training, body weight stuff, really, really good, but we need to make sure that you're able to tolerate that with impeccable form. So I would say that's the biggest thing, is find the starting point. Then we can develop a good map. Like I've mentioned before, if I'm here in Attleboro, and if I give you a map and it tells you how to get to Boston, we can get there really easy. If I give you that same map and I put you in California, but I don't tell you where you are, and I say go to Boston, again, that map is only good from finding where you're going to go when we have the right starting point. So for you, it's the same thing. We just want to make sure by knowing your starting point, and then we can develop a great program from there. The next question is, I have tennis elbow and it is not getting better. What is the problem? I've tried Graston, massage, cupping, dry needling, and I've spent a lot of money and I'm frustrated. What do you suggest? Really good question. I don't know if you tuned in before, but at the beginning of the talk, I mentioned a patient that I had. He started, I think, a couple weeks ago, and he came in again today. And he actually had tennis elbow, which is the outside, and he had medial epicondylitis, which is golfer's elbow on the inside. And it took him a little while to get a little buy-in, but what we both found through treatment over the 3 visits that we worked with each other so far, everything's related to his neck. If we can get the neck to activate the right way, we're going to generate enough strength all the way down to the arm, so the arm isn't having to work so hard. I also addressed his mid-back, because the mid-back is responsible for so much shoulder motion. It's just responsible for a lot of torso motion that we need to have as we're competing with any different activity or any different sport. If the upper back doesn't move, again, then the neck can't stabilize and the low back can't stabilize. Then we develop shoulder issues as well. So I would say that those are all really good techniques. I mean, I do Graston myself, I do cupping myself. We do dry needling in here in the clinic. All really, really good things. But again, you're treating the result of the symptoms of the neck. You're not really treating the cause of it. So that's it for tonight. Thank you again for tuning in. I really hope that this was helpful for you, any of you obstacle course racers, or any patients that have any of these injuries whatsoever. It's the same pattern I'm seeing, that everything is related to 100% predictable, and 100% of them are caused by the neck and the upper back. So if you can address those 2 issues wherever you're going for physical therapy, or going to see a massage therapist, or going to see anyone in the healthcare field, we have definitely a lot of good options. But especially, I'm obviously here for physical therapy. So if we can help you in that way whatsoever, just talk to your physical therapist. And if you're not getting better, maybe have them take a look at your neck or your upper back. If you have any questions, please feel free to reach out to me at toddh@houghtonphysicaltherapy.com. And I'm just excited to add more value to you and can't wait to see you next time. Have a great night.